Right, so the NHS is in crisis, but to a degree never seen before, according to senior figures operating within it. So here's my take on why I think that is. It feels like I've done this topic so many times. It does feel like absolute Groundhog Day sometimes to be yet again having to highlight the NHS crisis, because functionally it feels like every politician is sticking their fingers in their ears where it comes to the NHS or covering their eyes. Oh, the NHS is in crisis. It hardly seems like news anymore, but the Tories have made it that way with their reforms. I've lost count of how many there have been now, 3, 4, none of which have ever improved matters. It's just introduced more privatisation, hasn't it? But whilst services are collapsing to the point some 500 people are now apparently dying every single week because they aren't getting treated in time, people simply aren't getting to them. Where is the Health Secretary? Where is Steve Barclay? So far this year, he's tweeted just once. I know it's just the third, but still, once. And that's about a poxy Get Fit app. I wonder if he's got shares in it. I mean, the only reason I've been looking for him is to see what kind of a lash up he's making of this crisis, what nonsense he's spouting, but nothing, absolutely nothing. Has he been abducted? I'm only looking to him out of pure curiosity, really, not out of any sense that I feel that he knows what he's doing. He's never given me the impression he has a clue what he's ever doing. He just nods away to what he's told, like a good little Tory. But he's AWOL at a time NHS staff are giving out some of the gravest warnings ever. And we're talking about the likes of the Royal College of Nursing. We're talking about the British Medical Association. We're talking about the Society for Acute Medicine and the Royal College of Emergency Medicine. We're talking about the heads of those representative bodies, the most senior figures in them. And they are saying that things right now are worse than at the peak of the pandemic, that things are worse than they have ever been before, that patient care at the rate we're going right now looks set to be compromised at least until Easter. I reported on this just the other week. Just 2 ambulance services up until now this winter have not declared critical incidents nationwide. 10 NHS trusts have now called critical incidents. And a critical incident is when the service ends up so overwhelmed that they have to put emergency procedures into place, like cancelling training, redeploying staff to other areas where they're needed more, cancelling non-essential provision, but most of all, increasing third-party provision, getting the agency staff in, get the private health sector involved. Whenever you hear about private provision being involved in the NHS, yet stories like this keep on occurring, have you ever wondered what impact the private health providers are having? Well, mostly it's swooping in to provide increased support that has been driven out of the NHS itself over the last 12 years of Tory rule. Before that, certainly, but accelerated over the last 12 years, the Tories have been in power, certainly. And of course, the agencies charge more. The agency staff tend to be paid better and work better hours. And you can't exactly blame NHS staff who decide to leave the main service and turn to become agency staff instead. It all adds to the erosion of what was our NHS, our publicly funded NHS. So critical incidents end up happening more, costing us, the public, more. Don't for a moment think Labour right now would fix this either. Wes Streeting, Keir Starmer's shadow health secretary and a man with serious delusions of adequacy, wants to embrace private healthcare and involve it more. But when its involvement has been to systematically suck our NHS dry of its funding like some kind of billionaire-funded parasite, it's crippling the host, making it ripe for further takeover. Of course, donations to MPs like Wesley from people such as John Armitage, a man with some £800 million invested in private healthcare, can't possibly have influenced their thinking and led them to publicly attack health unions like the BMA for criticising their plans, of course. Not at all. Let's strip this back a bit. Take a slightly different approach here. Every area of the country has its own little bit of the NHS, community care, let's call it. This will range from your local GP services to your local minor injuries units, your local and general hospitals, and everything else that comes in between, physiotherapy, that kind of thing. NHS funding is funding to run all of that, and it gets divvied out so everyone gets enough to run their services. That is how it should work. That's how many people still think it does. Now, how many of those services over the last several years have you lost in your area? How many of those services have become increasingly more difficult to access? Do tell me, I'd like to know. Now factor in the Tories saying more and more funding, record-breaking funding, is going into the service, and inflation aside, where is the money going when your services are worsening or closing? That in a nutshell is the cost of privatising parts of our NHS and ever more parts of it. It costs more. We get less. Just as privatisation has done to everything else that was once publicly owned, that the Tories have flogged. Rail, water, energy, you name it, selling it off, wrecked it. When politicians call for more private provision, they're calling for what will be a more expensive, worse service. And when the health service has been wrecked as it has, when all the extra money going in is being wasted paying for privatisation, so these private providers get their cut, or indeed going on to pay the privatised sections of the NHS itself. And if you're going to bleat at this moment about NHS wastage at this point, then get in the bin. You sound like a Tory, or West Streeting, basically the same thing, because the amount of cash being thrown away on sticking plaster unsustainable options like agency staff, rather than investing in the service, as should always be the case, vastly outweighs that. The NHS has stood for more than 70 years for a reason, after all. But if this carries on, the service will be lost. Right now, during the winter months, it's typically the toughest of times but of course, critical incidents are no longer confined to just winter, and already 2023 looks set to be tougher than ever before for our NHS. Scarlet fever and strep A are prevalent right now, as is the seasonal flu. But hang on a moment, here comes COVID again. It's back on the rise, including a new vaccine-dodging variant apparently already here in the UK, possibly accounting for as many as 1 in 25 cases, despite Rishi Sunak implementing restrictions from China where it was thought to be contained. Too little, too late for the Tories again? Well, news broke last night that mask recommendations have been issued again, so it kind of feels that way. We'll see, I guess. But what bothers me most is that most schools are only now going back, and they've always driven the virus in our communities. That Easter date of our NHS getting back to more normal levels, still overstretched, shouldn't be normal, of course, is looking more and more optimistic, though. The Tories have trashed the service unrecognisably in little more than a decade, but we cannot ignore the fact that Starmer's Labour aren't saying they do things much differently either. People keep saying, save our NHS. But who's actually prepared to stand up and actually do that these days? It doesn't feel like any of our politicians are, does it?